have 4 strong women, 4 very powerhouse women with us to talk on the importance of strong pelvic floor and how it actually affects our life as women. So here at the studio we have Dr. Tok Pn Maziah. Dr. Tok Pn Maziah is expert on ONG, and she's an ONG consultant, an expert in the industry, a leading expert in the industry. On her side we have Sal. Sal is a fitness instructor who specializes especially in women's fitness. And we have Puan Khairulin. Puan Khairulin has issues with her pelvic floor and she's here to share. And we have the founder of Vibrance, who the only one in the world that comes out with a device to strengthen your pelvic floor, right? Not just the only one in the world, they're also the only one in the world that is clinically proven, medical grade, and US FDA cleared, as well as approved in 9 other countries. So let's talk first with Dr. Maziah, as a leading expert in this field, about the importance of pelvic floor, taking care of your pelvic floor. So Dr. Maziah, thank you for coming today. We're very honored to have you. Now, the issue about women's pelvic floor, pelvic health, it's somehow quite still a hush-hush thing, and not many women will talk about it. What's your experience on that, and with your patient, how do you deal with that issue?
Yes, I think this the era of hush-hush is gone. If you are keeping quiet about your problems, you're just going to be getting yourself into the complications. And when there are methods to solve it, to help it out, to share it, I encourage women to share whatever problems they have with the doctors or with their colleagues. And as you mentioned about pelvic floor, that is the lowest area in the abdominal cavity, and it supports the bladder in front, the uterus at the back, and the rectum. Stool passes through. We call it as a levator ani muscle. It's a platform like how should I say, hammock, with these 3 openings
linking to it.
Hammock, stretch from side to side, front to back.
Right. So that's a very, very powerful, important muscle for
yes. When does it get weakened? In women especially. It's also available in men, the muscles there in men as well. But for us women, we are designed to be pregnant, to deliver. And the baby, imagine the baby size, the head of the baby, 10, 11, 12 centimeter baby, must go through these muscles. So the levator ani muscles will soften, will stretch maximally when the baby goes through. So at the end of the delivery, these muscles normally will weaken, and some muscles will be lost, some fibers will be torn, and torn ligaments cannot heal. But the muscles you can build back the muscles and strengthen back the tone. So each delivery, each difficult delivery, you can imagine the amount of damage that can be done. In my 30 years of experience, I see prolapsed uterus. That's the final onslaught, final outcome of this maximally weakened pelvic floor, where your uterus just drops out of your vagina and you can see it. You can see it out there and you can't walk. A lump like a big egg is out there in between your legs. And inside the lump
is it painful? I'm asking so that other women.
In initial stage, you might feel a discomfort, dragging, pulling down sensation. And people will come to us say, I was coughing so badly and it came out. But that was just the last straw or the camel's back. It's already waiting to come out. The weakening has happened over the years. And menopause doesn't help. So multiple childbirth doesn't help. Difficult long labor doesn't help. And you have you're obese, you're so big, or chronically coughing away, or you have a tumor, already extra pressure in the abdominal cavity. So this poor levator ani muscle will just give way.
This muscle really works hard for us women.
It's important.
It's so important, right? Now, let's find out, Sal, since you're from the fitness industry, right? And it's a muscle. So does that has any direct relationship in terms of?
It does have like a huge direct relationship with training and improving your posture, improving your abdominal muscles, because as the doctor mentioned earlier, it's just a one big muscle. And an easier way to describe it is like a trampoline. It's like a round trampoline. And imagine on the trampoline, if you keep on jumping and jumping and jumping for a long time and not strengthen it, it gets weakened.
Yeah.
So the same thing for this muscle. If you're using your tummy is moving every day, so if you train your pelvic muscle, you're also training your tummy, you're training your core, you're training your back, you're strengthening your spine. So it does have a lot of effect, and I always tell a lot of my prospects and my clients that these are some of the main issues that they have: a lot of back pain, tummy pain, sometimes doing exercises, and they have no idea why it's happening. It's due to a weak pelvic muscle. And especially for women who, as the doctor mentioned, who gave birth, long labor, it does affect them and it affects their lives on a long run, but it's a hidden muscle. That's the problem.
Yeah.
We train everything else from outside, but we don't know how to attack the right muscles from inside, and that's the important part. If you train the right muscles, which is the pelvic muscle from inside, you can also see a lot of difference once you do any regular training, any other training. You could see a huge difference, especially in the tummy area and the core area, in your spine area, the way you're standing, the way you're moving, the way how your energy vibrates.
So
and
instead
changes.
of just working the tummy muscle, actually the muscle that you have to focus first and
First
foremost would be the
is the
pelvic
pelvic
floor.
yes.
What about the issue of where people weightlifting and because of that they experience the pelvic floor?
That's one of the
weakening? Yeah.
yes, that's one of the issues, because we concentrate on every other muscle of the body, and that does put a lot of weight on the uterus, as you mentioned. So once you train the pelvic muscle, you actually have much power to train, and it kind of connects to every other muscle around your body, and especially the abdominal muscle. Once me myself, lifting weights it's very good, but it can also cause me other issues. And if I'm not training my pelvic muscle, it did affect me where I had bowel movement issues. I had problems going to the bathroom. I kept getting a lot of pain once I finished my training. But once I started with Vibrance, it actually did a lot of difference. It did a huge difference. And since that day, since before I had it, because I knew the importance of training the pelvic muscle, I've recommended it to all my clients and all my prospects, and I'm making sure that they all get it.
That's great.
Yeah.
Fantastic. Now, Puan Khairuddin, you're already a mother of 4.
Yes,
4
correct.
pregnancies, 4 children.
Yes.
So what are the issues you have after giving birth, after pregnancy itself?
I think like the doctor said, especially when you have longer delivery, especially after my third child, the labor process was the longest, not as long as other people, but it was the longest. And I noticed that was when I started having weak bladder muscle. It's hard to hold when you need to urinate, and you have to quickly find a toilet and things like that. And
can leak.
yes,
It
yes,
can leak, yes.
yes. The leaking is, I think, is the worst of the problem, because it affects, like I said, when you sneeze, you leak, you cough, and then I also have allergies, so I sneeze a lot. So if I sneeze when I need to pray,
bless
so
you.
yes, so it
Then you have to go back and take your ablution again.
Yes, correct. That's
Yes,
correct.
it's
Issue,
another right?
yes, a lot of
Obviously, for
issues,
Muslim
yes.
women. That's an
Yes,
issue.
so especially after I have given birth, after my third child, that was the worst I think I experienced.
Can I
Yes.
share generally what can happen when,
Yeah.
when your pelvic floor muscles are so weak from front to back? Yeah. So from the front, the control the bladder neck, as we call it, is must be at the level of the muscles. If this level is below the muscle, even if you can do good contractions of the muscle, but the neck has now fallen below that. It's not working onto the neck.
I see. So it's
So
not
the funneling has
neck
happened.
is
Yeah.
dropped.
Yeah, the wall is so weakened that where the neck is so important to be at the level of the muscles, now below it. So even if you can contract that, you will not be able to hold that you will leak.
Oh,
So when you sneeze,
right.
yeah, because the has gone too low, so you will leak. Typically, we call it stress incontinence. If you have no stress, no pressure, no cough, no sneezing, you can control.
Yes,
somewhat.
yes.
So it's a weakening of the anterior, the front part of the muscle. So back, right in the middle there is your vagina.
Right.
So it expands that much, yeah, when to allow the baby to come through. At the end of delivery, it just come back together again. Yeah, but if you can tone the muscles quickly after in the postnatal period, you can get fairly good control again.
I think I was aware of you need to exercise right after after you have delivered after your delivery, but I think the problem is like Sal said that it's a hidden muscle. You're not,
So you're not sure whether you're doing it
Yeah,
right.
Yes, you think you're doing it right. You're contracting your abdomen. You read, but how can actually people show you that you're doing it right, and you know yourself that you're doing it the right. You're attacking the right muscle.
So you may want to add on that. So I think that's the reason why Vibrance was created in the first place, right? So how does Vibrance help in addressing that issue? There's a hidden muscle, it can't be seen. So what can we do?
Yeah, I think the vibration biofeedback, which I think everyone here is very familiar with, is really one of the most important key points, because prior to this, there hasn't been a way to truly teach people, I mean, professionals can do it verbally with verbal instructions, like, imagine the vagina opening as a vacuum and you're sucking in, or a straw, and different methods like that. But there's no one way to truly know whether or not the women, patients, it could be your mom, your sister, your friend, get it or not. Even in our experience, like with our clients who are using Vibrance Pelvic Trainer, at the beginning, they will find challenge to because it starts with the verbal instruction, and we would guide them and say, okay, imagine pulling your vagina towards you, towards your body, towards your spine, and often it's not something that women are like familiar with. Like, oh right, I know. No, but it's so ironic because the muscle is so important, and I mean we feel that it's very meaningful to be able to do something about it. Just a simple exercise, just letting users know how to do it correctly can solve so many problems.
So what do you specifically do in terms of the device design that enable user to know that it's the right muscle actually?
So the biofeedback, the reason we were cleared for FDA and stuff, because it's actually clinically backed. To be honest, there are devices out there that are pelvic trainers, but the problem is a lot are using what we call force sensor and other ways to detect the pressure. Yeah, for a Vibrance Pelvic Trainer, it's the biofeedback requires actual physical contraction, which is different. In other words, it's not detecting force. So if you cough, or let's say you are sneezing or something, just increase pressure in your body, in your cavity, it will not trigger. It will not give a reading. It requires an actual proper contraction. Then
It has to be squeezed.
Yes.
So if it's the right muscle, then it gives feedback, right?
Yes,
Apart from device,
that's right.
what else could women out there do to strengthen their muscles?
So what we heard is that you need to exercise, use the muscle again. If you want a flat tummy, you must do your push-ups. What do you call it? Crunches. Yeah. So I told my patients, they're so eager to use external wrap, the wraps to look flat again. But I said, beware. Is your pelvic muscle strong enough to withstand the pressure that you created?
Yes.
You make yourself so tight,
Yeah.
like using a corset.
Corsets.
Right,
The pressure has to be distributed up there to your lungs or down there.
I agree.
So
Yes.
just
So many
making a weak
women
muscle
have this
worse.
Yeah.
Actually, I say I'm not against using that, but you must firstly do Kegel exercise. We call it Kegel exercise, or Kemot in Malay. Yeah, easier said than done. So how to get these muscles to be trained, to be exercised? normally, as we said, we tell them what to do in the limited time that we have in the consultation office. Whether they do it or not, God knows. And then come back in the follow-up and say, nothing's changed, he's still weak. So they can't even know what to do. They have no sensation. They've lost some nerves during the process of delivery. So we ask, however hard you ask them to do it, no, you can't do it. Zero tone, or they get a bit weak. So if they can do it, fine. There's no need to have any other gadgets. They know exactly what to do, and I do put my finger in and test while they do a squeeze. I said, do it now. Squeeze for 5 seconds on my hand finger.
Okay.
So my patients.
It's part and parcel of your
postnatal care.
Yeah.
I said, I'm not worried about the reps. I'm worried about your pelvic floor. If you can't do this, whatever rep you do, you're not going to help that particular muscle. Yeah. So then when the Vibrance come, I thought this is so handy. Because before this, I would refer them to the physiotherapist. That will make them have to come to the hospital to show themselves to another third party, which they might not be comfortable with. And the follow-up. So a lot of people don't come back after the first consultation. So again, if you have a gadget that can be used at home, friendly enough, easy to use, that is much welcome.
I think that's one of the advantages, that it doesn't really take much of, it's not complicated. It doesn't need someone to sit down and explain the whole process for you. It's very easy, it's very user friendly, and it's pink and womanish and
there's one though. That's our, is it Asian, is it what? They fear to put stuff in, to put the vagina.
Now that's another issue.
They have not used tampons their whole life, they have a difficult time.
they have a difficult time.
Those who have used tampons, there's someone asked, have you ever used tampons before? They're the easier ones. They have no reservation. No reservation. Right. So I have 1 or 2 patients bought the stuff. Asked them a year later, do you use it? No.
Yes, that's funny, doctor, because I think there were women who I remember asking one of my friends, and she said, "No, I don't dare to put stuff inside." I said, "You gave birth to 4 big babies. Why are you still afraid to put things inside?" You know? So
It's that self-conscious, or in a way that any foreign object is foreign. A baby I made comes out, that's it.
But you must be too much in pain.
It's too much pain. Get it out.
Release of your concern.
Right. So, doctor, Tweet, you'd like to add up how actually Vibrance can make a difference in this sense, you know, and what it can do to other women out there experiencing all these issues and all these challenges.
I think to women who have pelvic floor issues, they need to know that you can do something about it. You know, I mean, it's a common misconception that it's okay after give birth, and you know, it's okay, and I'll bear with it for the rest of my life. I mean, to be honest, I think the urine leaking is one aspect about it that is a great inconvenience. You know, like you shared, you know, your Zumba activities and stuff, you cut down, you consider is there toilet that place, things like that.
The nearest toilet.
Yeah.
Just toilet. The nearest toilet is the first thing to find out.
And other aspects are also affected, like our sexual health, you know, after delivery, after being a mom. And the thing is, motherhood is a beautiful thing. It need not be like this. And there is something we can do about it, you know, and in a safe way, effective way, and women should take action. And you know, it's your life, you know, it's your life, it's your body. You should, you know,
So I think I have really no objections. I do prescribe the gadgets on my desk basically all the time. A lot of people are so reserved, conservative, just wrongly advised. But to put stuff in the vagina is taboo. So that has to change. The weakness.
Yeah, some people actually put other foreign stuff in there, you know. I think it's better to put something that is
Useful.
Yeah, it's you know, scientifically.
But
research.
the first expression is important. If the minute I open the box, they went stuff, stuff. They were convinced. Yeah, what's that? In my vagina. Stuff. we have to spend more time on them.
Perhaps
Eventually
you could
they
say,
will.
you want my fingers or you want this?
Yes. I've just done the pap smear on you. So, okay, you
Yes,
did.
yes.
This is me. I'm trying to put myself in.
Okay.
Another person can put something in, but
Yeah,
not myself.
But to be honest, the device needs probably a model. If you can come up with a model, and then rather than onto themselves straight away, so they be more they feel
More
positive,
comfortable.
more comfortable. Yeah, so they trial on a similar rubber model, whatever. Yeah. Then no point buying such an expensive item and never using
And you
it at all.
don't use. The key is to use it.
use it.
Anything at all. I think the key is to use it. Most important is to really exercise it.
To really
It's just like in the gym. I mean, you buy treadmills at home and you don't use it, again, there's no points as well, right?
But like you said, I mean, women do deserve to have that kind of sensation, especially after giving birth. I'm sure you go through many different issues and the loss of sensation, and that can also affect your mood and affect your relationship around your spouse, your self-esteem, your children. So actually working on that can improve many other aspects of your life without you knowing that.
Yes.
So that's really, I think that's really important, and thank you for doing that. I think on behalf of all women out there, thank you for coming up with such a life transforming.
Yes.
I would call it. Yes, life transforming device.
All right, thank you very much. Thank you, ladies, for sharing with us your experiences. Thank you, doctor, for sharing your expertise as well on this issue. And thank you, Sal, for sharing your expertise in terms of fitness part. Right, so ladies, if you want to know more about what Vibrance can do, and if you have issues, the main thing is if you have issues like urine leakage, incontinence, no more sensation, whatever the issue is, back pain, there's the solution. Get help. Go see your gynae, go see your doctor, and get in touch with Vibrance as well. Okay, thank you, and we'll see you again.